My name is Sophia Alfaro. I'm 17 years old and I'm currently living in Managua, Nicaragua, which is located in Central America. Today, I will talk to you a bit about my project towards healthcare equity, portable microfluidic diagnostics for marginalized communities. The problem. Around 47% of the global population has little to no access to diagnostics. The lack of routine blood work has a big impact on rural populations, as people have limited access to healthcare facilities and most travel long distances for better healthcare. Funding principle. Whole blood is composed of plasma, cells, and platelets. These components can be separated under density and quantity. The blood separation in centrifuge is done by spinning blood samples in high speeds, where the blood components get separated into various layers. The technique I selected to prove my hypothesis is microfluidics, as it is the most efficient one. Microfluidic devices for diagnostics are comprised of components that can regulate limited test samples, providing advantages such as reduced reagent volume, less expensive experiment costs, high throughput, and even accurate findings. Hypothesis and project. The development of a portable and user-friendly microfluidic system integrated with optical biosensor technology allows for accurate diagnosis of disease-causing pathogens, reducing testing time and reagent usage. That is my hypothesis, and if I am able to prove it, this will facilitate point-of-care testing in rural areas, lacking access to quality diagnostics, ensuring prompt and accurate treatment, particularly benefiting vulnerable populations such as the elderly and youth that have weaker systems. The sustainable goals I'm addressing are health and well-being and reducing inequalities because my target audience are low-income, marginalized, and rural communities. And because I'm going to partner with local pharmacies, I'm going to be able to put my services much closer to them, therefore making it easier for them to access. This is my initial prototype. Something that is really important to note before continuing is that you need to make a lot of different prototypes in order to find the most efficient one of your product or service you're offering. So in this part, it is the blood inlet. Basically, the blood sample goes through here to the plasma chamber with drainage system, and then it goes either to the RBC chamber or the WBC chamber with drainage system, or to both, depending on how many blood particles of each of those has in the blood sample. Experiment to be conducted. Flow rate of blood in the device. Measuring 30 milliliters of blood using a cylinder. Then pouring the blood into a funnel connected to the device and letting one go. Then inserting a stopwatch as soon as the blood enters the device to see how quick or slow it is. Then placing a roller under the microfluidic device to measure its movement, and stopping the timer once the blood has completed all that procedure. Basically repeating that for the next device or prototype we make, and then comparing results to see which product or service is best. That is why it's so important to keep trying to improve your prototypes. Conclusion. Conducting research from a young age is not easy. From narrowing down your target audience to developing experience that prove your hypothesis, there are many challenges. However, the expertise and knowledge you gain is invaluable. As I move forward, I recognize the immense potential of my research to transfer healthcare access, promote inclusivity, and even break down barriers for those historically underserved. Research is not an easy path, but I believe that with enough passion, discipline, and interest, anyone can contribute towards a field of interest. I hope this talk was helpful to you, and feel free to drop any questions in the chat. Have a great day.